The Navajo Nation, one of the hardest hit parts of the country when the pandemic started. Our Cameron Polam checked in with the tribe today to find out what their plan is when a vaccine finally hits the ground.
Way of life on the Navajo Nation faced serious threat once the coronavirus pandemic struck earlier this year, overwhelming local hospitals and stretching families to their emotional limits.
It has taken over 630 of our Navajo people's lives.
President Jonathan Nez has been leading the battle there since the beginning, distributing supplies and support to its farthest edges. His sights now set on the rollout of a vaccine.
We have a larger percentage of people that are diabetic, that have cardiovascular disease, that have cancer.
Populations that remain at serious risk to the virus's deadly consequences. On Tuesday, the federal government is meeting to finalize recommendations on who will receive the first round of vaccines and what that supply will look like. President Nez says his community should be one of the first in line.
I am sure that it will be most likely drive-through, based on we're still going through a pandemic.
The distribution will be run by 8 health units across the Navajo Nation, each with a number of vaccination sites, using social media outreach to alert community members on when and where to go.
Of course, that means we have to buy these freezers that are going to have to keep the vaccines very, very, very cold.
He says those freezers are already in high demand and worries getting their hands on enough could delay the rollout. Dry ice companies are now being called on to be ready. In fact, Airgas, a company with offices in Buckeye, says they are in active communication with federal agencies and are carefully managing dry ice supplies that could help support storage of sub-zero vaccines. Despite the challenges that lay ahead, President Nez is confident his people will once again rise to the occasion.
We're resilient. We overcame, and we will overcome this.
I'm Cameron Polam, ABC 15, Arizona.